name is Henry, and this is my presentation on the next pandemic. The disease I came up with is called Fons febris, meaning fountain fever in Latin, since it originated from a geyser, which is like nature's fountain, and has symptoms that are commonly associated with a fever. Fons febris was caused by Fons pandemus, which is a fungus that spreads through airborne spores, and it originated from hot springs like those in Yellowstone, and the spores have become aerosolized through geysers. The spores then settle in the alveoli of the lungs, where they can cause severe immune reactions, and they're transmitted either through the geysers or from people coughing and sneezing. Due to them coming from hot springs, they have evolved to survive at warm temperatures like body temperature and in slightly basic conditions of the lungs. And they have a latency period of about 8 to 12 weeks. And the cells of the fungus form a biofilm, which makes it very hard for antifungal medications to treat it. The hot springs in this case are acting as reservoirs, and it has an R naught value of 16.7, meaning it's highly infectious. Socioeconomic and cultural factors that influence the spread of the disease. The first one is going to be overcrowding, especially in low-income urban areas or in developing countries. And that is because people living in these areas are often living very close to each other, and their housing is not very well ventilated, which is going to contribute to the spread of an airborne disease. And the second one is going to be people seeking alternative medicine, such as Eastern medicine or herbal remedies, instead of a proper diagnosis. And this would cause a delay in diagnosis, which means the person is in society able to infect other people for longer. And this can also contribute to distrust in the government, which brings us to our third factor, and which is resistance to public health initiatives. This might be because places have historically corrupt governments or people just don't trust the government, but it can hamper initiatives like contact tracing, lockdowns, and vaccinations. And the fourth factor is going to be people in poverty or less developed nations that just have a reduced access to healthcare. And because they don't have as good of access to treatments or sanitary facilities, and it might be more difficult for them to quarantine or have lockdowns, it's also going to contribute to the spread of the disease. Disease surveillance strategies. So the first strategy is going to be tracking patterns of symptoms that match for Fons febris, but not with confirmed cases. And these symptoms are going to include shortness of breath, coughing, sore throat, etc. So by not waiting for a confirmed case from a lab, this is going to help quickly identify areas that might be having an outbreak, where we can then dedicate resources and react quickly. The second strategy is going to be having actual lab testing for confirmed cases. And this is important because it's going to allow us to see trends in how the disease is evolving and identify new strains of the disease, as well as how it responds to vaccines and treatments. And the third strategy is going to be collecting data from hospitals on patients based on demographics like age, gender, and existing conditions. And this is going to help us identify populations that might be at a higher risk, such as those that are already immunocompromised. Management techniques. The first one is going to be limiting access to disease reservoirs, the geysers and hot springs, and in already infectious hotspots. And this is going to be done by implementing lockdowns and quarantines of those areas. And for the people that do have to go into those areas, like healthcare workers, there's going to be strict decontamination protocols for going in and out of those areas. The second management strategy is going to be wearing masks, improving ventilation and air filtration in densely populated areas like schools, public transport, and offices, or densely populated neighborhoods, in order to remove those spores and decrease the rate of new infections. The third technique is going to be developing an antifungal medication that can get past the biofilm, and this should also be able to neutralize the already airborne spores. Um, and this would help treat people that are already infected and reduce mortality as well as reduce infectiousness. Here we have a disease management plan for New York City. And the first thing that we're going to do is we're going to use data from hospitals to create an infection map to show where the hotspots are. And this is going to allow us to better allocate the resources that we do have and to contain the spread of the disease faster if we prioritize these areas instead of possibly running out of resources or being too slow if we did not. The second thing is going to restrict travel to and from hotspots. We're going to use lockdowns and quarantines to make sure that people don't travel in and out too much and spread the disease to areas which are not highly infectious. And we're going to deploy mobile health teams with supplies like masks, tests, and education materials, as well as antifungal medications to take out dormant spores and air filters into these hotspots to contain the outbreak. And the third thing on our plan is going to be partnering with schools and churches, news outlets, and other trusted institutions within communities to spread accurate information about Fons febris. And we're going to educate people on things like symptoms, mask wearing, and when to seek medical attention. We're going to focus on prevention as well as trying to gain the trust of the people for the government and public health initiatives. So when we're trying to speak to the public about this pandemic, what we say is going to change depending on the demographic that we're trying to communicate with. In this case, we're going to compare a big city like New York City with a small town in the South, possibly like the ones around here in Gainesville, Florida, maybe like Micanopy or Hawthorne. So with New York City, we're going to have a high population density and a bunch of people from diverse ethnic backgrounds who have a range of healthcare access, but generally are going to have access to higher quality healthcare and more resources, and they're generally going to be more trusting of the government. Whereas in a small rural town, they're going to have a much lower population density. They're going to be predominantly English speaking, and they're going to have access to generally lower quality healthcare and less resources. And they might also be less trusting of the government or be more self reliant. So in New York City, we can use all of the digital signs and billboards like those in Times Square to put up infographics on symptoms, masking, ventilation, and other techniques of preventing airborne transmission or just managing the disease in general. We can also broadcast news from the government or government initiatives such as quarantines and shutdowns. Whereas in the South, we're going to use messages written in plain English so that everyone can understand them, and we're just going to broadcast them over the radio or print them out on flyers to be handed out. And we're also going to emphasize maintaining local control and letting people protect themselves and families instead of just trying to get them to follow a government mandate. We're going to emphasize relying on themselves and maintaining a clean and sanitary household and recognizing symptoms early. And we're going to work with local trusted institutions like churches instead of big state or federal agencies to distribute supplies and education. Now we're going to compare the differences that you might see in how we communicate with healthcare providers and the general public because what your doctors and nurses and hospital administrators need to know in order to respond properly to the disease is going to be different from what the average person should know to respond properly to the disease. So for healthcare providers, we're going to ensure that they are up to date on all of the treatment, containment, and reporting protocols. We're going to make sure that they get all of the CDC and WHO guidelines sent to the health departments and hospitals of every state, and that they are dispensed properly to all of their healthcare providers. We're going to make providers go to mandatory training sessions and update them on new info about the disease as it comes out, such as how Fons pandemis is behaving, how it responds to treatments, how new strains may have emerged, and how those might be different. And we're going to provide reference manuals for treatment, containment, diagnosis, etc. Now, for the general public, we're going to educate people on the symptoms so that they know when they might have the disease, and we're also going to educate them on prevention, such as masking and proper ventilation, and where to get medical attention if they do happen to get it. We're going to broadcast this information over social media campaigns such as on Instagram, Facebook, YouTube, etc., with short videos that people won't get too bored of and will be likely to watch in their entirety, as well as with infographics and live sessions where people can ask questions about the disease. We're also going to do this in many different languages so that people from a diverse array of backgrounds can actually understand. And we're going to partner with local institutions like schools, churches, and community centers, etc., to provide people with the information that they need. And we're going to broadcast this over radio and TV as well. In conclusion, Fons febris will be the next pandemic if it were real, because it combines all of the characteristics that a disease would need in order to be a successful pandemic. It's fungal and it has biofilm, meaning that it would be very difficult to develop a vaccine due to the genetic complexity of a fungus, as well as the biofilm making it very difficult to treat. It's also highly infectious with that R naught value mentioned earlier of 16.7, and it has a long latent period, as well as being airborne, so it can spread very quickly without being noticed. This, combined with its ability to survive without a host for a long time, gives it an advantage in densely populated areas such as cities, especially in low-income areas with poor sanitation and ventilation. So Fons febris ticks all of the boxes for a pandemic, and if it were real, it would very easily be able to overwhelm healthcare systems around the world, and it could pose a very serious threat to global health. And if governments haven't learned from COVID-19, then this would be an even worse case scenario. Here are the references I used, and thank you for listening to my presentation.